much for joining us today, Dr. Khairil.
Thank you so much for having me.
Perfect. And before we begin, I would like to acknowledge the traditional owners of the land we are both meeting on. I am based on the Gold Coast, so I would like to acknowledge the Common people who are the traditional custodians of the land we are meeting upon today. I would like to pay my respects to elders past, present, and emerging. Thank you so much for joining us again.
Yeah, I might also quickly acknowledge where I'm zooming in. So as you said, I'm in Alice Springs at the moment. Therefore, like to acknowledge the traditional owners and custodians of the land, the Central Aranda people of Pampatwa. I pay my respects to the elders past and present, extend that respect to any Aboriginal and Torres Strait Islander people.
Thank you so much.
So thank you for having me. No worries.
Thank you. So we can jump in. Can you give us a timeline of your career from medical school to where you are now?
Yeah, okay. So I went to medical school at Sydney Uni, and so it's a while ago now. I'm just trying to think. 17 years ago, maybe. Oh gosh, I feel really old saying that. So I did graduate medicine and med-sci, pretty standard undergrad. And then I remember, I think at uni, actually seeing a speaker from MSF talk about their career with MSF and being very, very inspired by that. So had made it sort of my careers and life mission to work for MSF. And I started initially through after uni wanting to be a surgeon, and then kind of somewhat quickly changed my mind to doing ICU and started my ICU training, and knew that I sort of had to be quite senior in order to be able to work for MSF. So I actually waited for a while until I was my last year of training with the College of Intensive Care Medicine. And then in 2019, I actually applied for MSF and thankfully got accepted, not expecting to be deployed. And then COVID happened. And very quickly, they needed intensive care profiles, and I got deployed for my first mission, which was in Yemen. So that was in 2020, at the start of COVID. And then I've had multiple deployments since then to Iraq and to Afghanistan. Most recently, in the middle of last year, to help set up a major burns unit there. So, and I'm currently now working as a half-time specialist in Alice Springs, and I still work for MSF as well in a kind of non-clinical role, but occasionally try and see if I can get back out to the field.
That's amazing. And the journey from medical school and seeing a MSF viewer must have been so inspiring. Just for our viewers who will be hearing this interview at some point, what was something you did after you had that experience? Were you involved in any clubs at uni or anything like that?
Yeah, so a good question. I guess I tend to kind of process a lot of things internally, and I think I did a lot of reading about MSF as an organization and looked into what they wanted out of the doctors who worked for them, and I knew that some of the things they valued were experience working in remote settings, so in traveling to kind of different places and experiencing different cultures. So whilst I didn't specifically, I guess, join any clubs at uni, because we didn't think at the time necessarily had one that kind of facilitated that, I kind of made it important to make sure that I was kind of well read and well traveled. And then I did some of my electives in Malaysia, actually. That was just where my family's from, and in a very remote part of Malaysia, in order to gain a bit of experience again in a system that I wasn't used to, as well as to try again broaden my experience and knowledge, which I know MSF likes. So no specific clubs per se, but I definitely kind of try to just be a bit more global, I suppose, in terms of my perspective. And obviously trying to learn as much as I can of medicine, because ultimately you still have to be able to have that skill to bring to the field.
Sure, that's incredible. And so from the sounds of it, medical students should try, if they want to go into MSF, should try and get some experience in rural, remote areas and just trying to understand a bit of culture. Is that right?
Yeah, definitely. I think that that's helpful, especially I think because I do get asked from medical students, junior doctors, many others about what MSF values, and I think typically, of course, training in a specialty and being a specialist is at the top of the list because that's kind of what and we're kind of short in terms of profiles, but it doesn't mean that just because you're a specialist you're a shoo-in because again it's important that that clinical knowledge is grounded on um, worldly knowledge too, I guess. So an understanding of different cultures and an ability to adapt to the differences that you'll be facing, and the differences is pretty incredible. So I think there's quite a lot of different aspects that medical students can start thinking about from early on, and build upon that over time. And that's sort of basically what I did. So because like the journey from when I first wanted to join MSF till when I actually did, I think probably was more than 15 years. So I think it is not necessarily a quick a quick journey, but I think it's worthwhile because the work's incredible.
It's amazing. And so you mentioned that you've had a lot of different missions. Your
Mhm,
first one was in 2020 during
mhm,
COVID in
mhm.
Yemen. So I guess what were you involved in during that time?
So I was involved in the setup of MSF's first COVID-19 treatment center in ICU.
Wow.
So it was obviously 2020 was a pretty rough time for the whole world, and Yemen um, at that time was in the midst of the Yemeni civil war. So there was already war happening, and then
Wow.
often in places where there's conflict, something else like a pandemic just kind of makes things that's bad to worse.
Mm.
So therefore, it was recognized that they needed a lot of help to try and manage COVID-19 cases, and the healthcare system there was at the brink of collapse already. And when COVID happened, obviously that again precipitated the situation. So I was there with a team of international doctors, nurses, and other kind of profiles to try and set up this COVID-19 hospital, essentially to treat patients with COVID-19.
Wow, that's incredible.
Mm,
And so I guess from that first experience you've had, and you've said you're working on current
mm,
missions as well, what was some of the things that you learned and you've, I guess, learned to overcome as
mm.
well?
I think it, so much. I think that my
Yeah.
first mission literally was life changing. I think as kind of maybe as silly as that may sound, it truly um, gave me so much. And I think there's obviously the clinical side, and because you're working again in a setting that's very different to what you're used to. Like I trained in Sydney, and used to having pretty much the availability of all specialties, for example, all the kind of equipment. I work in ICU, and we have pretty much the most kind of advanced equipment to be able to look after patients. But when you're in a conflict zone and in a place where um, COVID's suddenly arrived and then the whole world closed its borders. So we couldn't even actually bring in supplies. It was actually quite difficult to bring in
Oh,
supplies.
wow.
So I think for me, it's learning how to adapt when we had very little, and that includes even access to oxygen. So I think just having to be so uh, methodical about the way we looked after our patients, but also having to experience pretty profound suffering because many patients died due to the lack of availability of resources. And I think that the learning is not just in how you treat patients under extreme circumstances. Also, I guess learning how to cope with the amount
Sure.
of suffering and and um and death that you get exposed to working in settings like that. And I think I guess I also learned to be quite adaptable. I think that that is something that I find, being when I'm back in Australia, actually um, is still useful because I think, like you're dealing with very stressful, very high-paced situations, having to make split-second decisions, and all those skills are actually skills that will be useful as a doctor, regardless of where you work. And I do find that the experience working for MSF just recalibrated a lot of the stress I had working in Australia and just kind of puts things into perspective quite well.
Oh, yeah, so I guess dealing with all of that death and suffering must have been incredibly challenging. And so
Mhm.
I guess you mentioned that you learned how to cope. So what were some
Mhm.
of the coping strategies that you learned to develop?
Yeah, so I think a couple. I think I guess one thing that, and this is something that MSF does teach you, is like recognizing in yourself when you are stressed. I
Mm,
think sometimes maybe that's something some people learn to do over time, and some people actually still may not learn, is not recognizing, what are some of the kind of signs that you're stressed. And I think, and some of that may be quite physical. Like I know that when I'm kind of stressed, my eyes get really tired, for example. And some people get hangry, right? Like that kind of other typical stuff that sometimes we don't recognize as signs that your body is just saying, hang on, just have a little pause, or, have some food, or, you know, go and have a wee, like, just kind of these basic human needs that we learn to ignore, I think, when we become doctors, because of course the job's very stressful and very demanding. And I think that working in an MSF setting, I think that becomes um, like it kind of goes to an extreme end. So because you're not just dealing with kind of the day to day of a hospital, you're dealing potentially with security and risk, like security threats,
yes.
and also, yeah, like a hospital that might only have 30 beds, but there are 100 patients that are there. Like, these are some of the kind of challenges that you're dealing with. So I think if you can recognize when your body is telling you to have a little pause, I think that's very important. And I kind of learned how to do that. Um, Other things as well, I think just leaning on your support systems. I think that's really important. Your friends, your family. Obviously, when you're working, like when I was working out in the field, I was started working with strangers essentially, but pretty quickly you become very close because it's such intense work, and I think you then learn to lean on each other and then try and support each other and just have a little break. And like I remember when I was in Yemen, because the context, it's kind of in the Gulf, so actually it was really close to the beach. So we used to just go out at night and just have a little swim. So that was pretty cool. So a few of those things I think are helpful, and I think ultimately you have to figure out some strategies that are helpful to you, because what works for me might not necessarily work for other people. And I think it's just part of the learning and the growing of being a person, but also being a doctor, is figuring out what you need. I think to be able to keep yourself sustained, because as I kind of alluded to earlier, if you want to work for MSF, the road to getting there is quite long. But I think if you want to have a kind of fruitful career as a doctor, I think equally that's long. So you just have to kind of figure out a way to be able to do that.
I think medical students right now, we often find it difficult to cope with the stresses of life. So I
Hmm.
think students hearing about this it'd be really valuable for them. And I think learning how to cope with these through medical school is, I think, very important. And
Yeah.
so, and I can see that it carries through into your career as well, especially as an MSF
Mhm.
physician.
Yeah, yeah, definitely. I think the earlier you start learning good habits, I think the better. I think you probably I sort of definitely even recognize it in myself. I sometimes do wish that I kind of built some healthier coping strategies even when I was a junior doctor, because sometimes like I somewhat learned it through my years of training, and I think that if you can cultivate that early, I think that will be very, very helpful, and it will serve you well. I think that's it, because I'm sure you know that rates of burnout in the medical profession is exceptionally high, and I think if you're interested in a career in the humanitarian world, that sometimes can compound. It doesn't necessarily mean that the rates of burnout in humanitarian work is the highest. Just that I think that some of the stresses that you have to deal with will be greater, and I think the better you can be at managing stress, I think the better you'll be served.
Thank you. And I guess you've mentioned that you've had experience in Iraq and Afghanistan as well.
Mhm.
Can you give us a rundown of what things you were involved in both of them as well?
Yeah, so Iraq was towards the end of 2020. It was also for to help set up a COVID-19 treatment center in ICU.
Mm.
And I had quite a lengthy break between that mission than my mission in Afghanistan, because I finished my last bit of training, set my exams, and so I didn't go back to the field till 2023 for Afghanistan, and that was to work at a trauma hospital that that MSF owns in the north of Afghanistan, in a place called Kunduz. So it's kind of this very mountainous region near the border of Tajikistan, which is the country to the north, and it has a population of about 1 million people, and about 8 to 9 hours drive from Kabul. So it's quite kind of remote, and we kind of together we kind of fly in our own MSF or UN plane, and because it's so remote but very populous, the healthcare system it struggles to be able to cope with the demand. So that's why MSF, we have a trauma hospital there. So I basically was there as an intensivist and the clinical lead, and went there 3 times. So I worked in the hospital 3 times, and to the same hospital I went last year to help set up a major burn unit, which is a new project that we were trying to implement.
Sure. Okay. And with this burn project, I guess what was happening at the time that led to having this clinic?
Yeah, so I think in many limited settings or areas of conflict, access to kind of specialized care is often very limited. So for example, in the region of Kunduz where I was working, if patients or people had significant burn injuries, the local hospitals were not able to manage these patients. So previously they had to travel quite far to Kabul, 8 to 9 hours. If they had access to a car, it might be longer if they go, if they have to sometimes ride a motorbike or other means, um, and some of these patients that we would treat would unfortunately die because they didn't have access to good quality burn care. So that was recognized by MSF as an area of need. So therefore, then we started this project in Kunduz, mainly as a pilot to see how we can implement burn care in other projects with MSF around the world, and hopefully with the knowledge of that, then be able to open more burns units in other places where that isn't available. So it's a pretty big undertaking. Burns care is very expensive, and requires a specialist burn surgeon, burn nurse. There's a lot of burn physios. Like there's a lot of kind of resources and skills that are involved to providing good quality burn care. So it's still very early, and then I think it will take a bit of time for it to kind of mature. But yeah, we're hoping to be able to kind of do more of it around the world with MSF.
And so you've had a lot of experience on MSF through many, many years. So for you, what was the most eye-opening experience? For example, a story that might have happened.
So got so many, gosh. I'm trying to think.
Tough question.
No, that's a good question. I suppose the experience that was a defining experience of both my life and career, I think, was definitely working in Yemen during the COVID-19 pandemic.
Sure.
I think one particular events. I guess one particular situation that was quite tough was we had a doctor, like a Yemeni orthopedic surgeon, who came to the hospital with bad COVID-19. And I think you may have a sense of this already, but there is something different that you feel when you're treating your colleagues. Not that the care is necessarily different, but I think there's this kind of sense of kinship, I suppose, with patients who are fellow doctors. And I remember him coming to the hospital and then needing to go to the ICU because his hypoxia, respiratory failure, was getting worse. And there was a period when it looked like he was going to get better, and he needed a lot of oxygen, as many COVID-19 patients do. And one afternoon, our work, we had like these tanks of oxygen, and they exploded because it's kind of not necessarily the place wasn't necessarily designed to be able to manage lots of oxygen, and he unfortunately deteriorated because he was off oxygen for a somewhat prolonged period. And we had to make the tough decision to intubate him and put him on the ventilator. And knowing at the time, this was relatively early in COVID-19, that most patients that end up on the ventilator unfortunately die. And this was before we started using steroids and all these kind of treatments that definitely improved outcomes. But I remember having a chat to him and saying that your oxygen level is really low, and we have a tough decision to make. And he was still able to talk, and I told him that the choices is that we continue. And he had a non-invasive mask to try and increase his oxygen level, and I said, or we put you on the ventilator and see if that will help. And he thought about it and he said, put me on the ventilator. And I told him that you understand that we may not be able to help you, and even if we tried that. And he said, I understand. I think we should give it a go, and we did. But unfortunately, he still died following that. And early again in COVID-19, many patients died from multi-organ failure. Because COVID-19 wasn't just an illness that affected the lungs, it was this kind of inflammatory illness that affected all the organs in the body, and we had no ability to do dialysis and all the other things that we would normally be able to do in Australia. So I found that a particularly sad situation because, as I said, it's tricky sometimes when you treat a fellow doctor, but even more so when you're placed in this almost impossible situation. Because of the circumstance, like if the our oxygen supply didn't kind of like explode, then he probably would have been okay. But those are one of those things that we just can't predict, that unfortunately happen when you work in conflict zones and places where they don't have very much. So I think about that a lot, because I find great satisfaction in the work that we get to do for MSF, but it's also pretty profound, the responsibility that work carries. And I think therefore then I kind of always make it clear to myself that I need to be well trained, and I need to make sure I've got the skills and that my knowledge is current. Because when you work for MSF and you go to these places, you don't have a team to rely on. A lot of it is just you. And I think because of that, the responsibility is pretty incredible. And therefore, then I always feel like you need to kind of be the best prepared you can be to be able to manage these situations, because it's pretty tough sometimes.
I'm really sorry about your loss, and I can't even imagine like going through all that stress while having to treat for so many patients, the level of stress you must have been going through during that time. And I guess I can really see how rewarding the experience is, but then there's a lot of, I guess, things that are drawbacks about working in MSF sometimes as well. Have you noticed any other benefits or drawbacks when you've been involved in MSF?
Yeah, I think I would say that by far the benefits outweigh the drawbacks, and I think some of the most inspiring people I've ever met in my career, people I've met working for MSF. And that's not just kind of other MSF international doctors and nurses, it's really actually the local doctors and nurses that you work with. So MSF employs a lot of local doctors and local nurses, local staff, and they actually make the bulk of the people that work for MSF. And they don't have access to the same training opportunities that we would. But I've worked with incredible trauma surgeons that can do surgeries that 5 surgeons do in Australia because they've just developed that skill over years and years of being in a war zone. And even despite some of the resource limitations, the outcomes are actually pretty incredible and pretty good. And that's credit to the staff that work in these places. They're always also so grateful for the opportunity to I guess learn from you, and that's kind of what I like doing as well. That I see my kind of role. It's not just in looking after patients, but actually in trying to call it capacity building, where you're trying to impart your experience, your knowledge, and try to elevate the skills and the knowledge of the local doctors and nurses. And I find that to be such a blessing to be able to do that. And equally, when you're there, they're very, very kind of open and inviting you to learn about their culture and their background, and being able to experience the richness of that is also pretty incredible. I like that. I guess working for MSF, as I kind of said before, it does recalibrate the way you perceive your role. I think your fellow medical students will appreciate this probably once you start working as a doctor. I think it feels very easy to get lost in the machine sometimes, especially when you work in these big, city hospitals, and you might sometimes, especially in your early years, where that work feels a bit more administrative rather than clinical, and you might feel like you're not valued as much as you should be, and you sometimes feel like you kind of get again a bit lost, and you're just another person on the floor, and that it doesn't matter if you're not there because someone else will quickly replace you. And I do remember feeling like that as I went through my training years, and I think the thing about working for MSF is that the kind of the sense of value that you see your role is just bigger than I've ever felt working in a big hospital, and I think that's the same. Like, I'm a consultant. I've been a consultant for 2 years, and I sometimes also feel, even as a consultant, sometimes you're kind of lost in the bureaucracy of the machine. And obviously, we do great work, but I do find when I'm out there in the field and you're dealing with pretty horrific stuff and you're trying to make sense of it and you're trying to do your best in that situation, when you do get good outcomes and you do see the differences and the improvement that happens even over a short space of time, I think that's a feeling that I've never kind of experienced besides working for MSF. The drawbacks, I mean, there are a few drawbacks, of course. I think it's pretty tough work. It's pretty intense. So I don't go for very long. I go kind of 4 to 6 weeks typically now. But every day you'll be on call, and like you're pretty much woken up every night, and there's some emergency, some complicated case that you need to be involved in. So it's quite tiring. You're kind of expanding a lot of cognitive load because again, you're not working in a big team. You don't have a couple of consultants to kind of bounce ideas with. It is relying a lot on you, and I think that can be quite tough. Yeah, and of course the security situation is also tricky sometimes to navigate. There's a lot of danger in some of the places we work in, and that's a risk that I think different people are okay with and have to accept. And MSF tries its very hardest to make sure we're safe, but sometimes things do happen. So, I think couple things to keep in mind, obviously.
Sure. Thank you so much. I think medical students right now, I think MSF seems so wonderful. So hearing both the wonderful side and some of the things they should consider before joining is super important. So thank you so much for that.
That's okay.
And you said that you're currently based in Alice, and from my notes, it says that you're doing some FIFO work. Is that correct?
Yeah. So I fly in, fly out. I'm here 3 weeks every 2 months, and a little plug for the place only because I think if you like MSF and you want something that has MSF flavor, Alice Springs is a great place to actually work in. It's like Alice Springs Hospital. I work as a consultant in the ICU. And the patients we get, like 70 to 80% are patients of Aboriginal background. And obviously, there's a high burden of kidney disease, high burden of cardiac disease, and they often come from very remote areas, often present quite late with some very unusual infections and things that you won't typically see in city hospitals. So they're very, very sick patients that come. But I think the hospital, just even though it's in a remote place, actually has access to quite a few different specialties. So I think it's a pretty cool place to work. You see some incredible medicine, and I think you also again get to experience a different culture and a different way of life, and that's been my learning. I think I've been only working here for 3 months or so, and it's still still a long way for me to go in terms of understanding the different cultures and the different needs of the community, and that I think keeps the work very interesting.
Very nice. So it seems that you have a lot coming up. So in the future, we'd love to see more from you, I guess online or with us again.
Of course.
But I guess just like moving towards medical students and the application process,
Yep.
can you give us a rundown of what the application actually looked like?
Yep. So it's so there's a 3 parts, if I'm not mistaken, because it's been a while, but I'm pretty sure it's still 3 parts.
Sure.
So the first is usually you have to attend a MSF information night. So it's organized through MSF Australia, and it usually involves listening to a few MSF field workers like myself or others who've done a bit of work outside of Australia and talking about the experience and what it's like, and being able to ask questions. And then following that, there's an online application which is quite involved and takes a bit of time, and a lot of it kind of goes through your skills, experience working in remote, rural, or different settings. Another kind of thing that MSF values is languages. So being able to speak French is very, very valued. Arabic is the other one. There's a couple others, but like having that skill is definitely puts you ahead in terms of your competitiveness. And then also there's some questions about your availability and kind of what that kind of would look like. Typically, especially for doctors, many of us, like I still obviously have a job in Australia, and trying to kind of fit that in with MSF deployments and things requires a bit of juggling. So once you do the application, it gets looked at, and then if that goes through, then then you're invited for an interview. I think they do it virtually now, but it's a pretty long interview. I think the longest interview I've ever done, I think it's about 90 minutes, and it's less, I guess, interview in the way we would think an interview. I kind of felt like it was more like a chat for them to get to know me as deeply as they can, and kind of going through a lot of the things we already spoken about, like what your motivation is and how you deal with stress and how you deal with having to live with people that you work with, because that's the way MSF kind of operates, and then experience working in different settings, and so it's not dissimilar to some of the stuff you already been asked in the application. and if you're successful through an interview, then you get invited to a training, call it the training days, where you then go into a bit more depth and detail about what working for MSF looks like. And it's quite fun, very social, and you learn a lot. And then you wait for your mission, your first mission, basically your first deployment, which might take different, like if you might have to wait either a long time or not very long. I didn't wait very long because COVID happened. But I think if COVID didn't happen, I probably would have had to wait at least, typically I think the average they said 3 to 9 months sometimes for your first deployment. That's about matching you to a place that's appropriate for your first time and with the skills that they need. I suppose the other thing that's probably worth knowing if people are keen to work for MSF is the earliest you can apply to work for MSF is PGY3. So it's an RMO2. I applied, and this rule has changed for intensive care, but I applied at a time when they were still accepting senior trainees in intensive care. But now, if you want to be deployed as a specialist, you need to have had your fellowship, a specialist qualification, and have worked for at least 2 years, I'm pretty sure. So for surgeons, anesthetists, so kind of specialist profiles. If you were to apply early, you can. That's a much more competitive pool. There's a lot more doctors in that pool, so the chances being accepted is slightly lower, but also the chance of being deployed is also lower because there's a lot more people in that pool. And that will be to low security type work. So it's usually like nutrition campaigns or vaccination campaigns. So it's not high security kind of contexts are typically only for specialists. And the reason is because for the kind of low security context deployments, you get sent for longer. So it's usually 6 months minimum, 9 months, sometimes to a year. Whereas when you deploy as a specialist, I can go for a short, like I think the shortest mission I've been to was 3 weeks, 4 weeks or something like that. And that is just a recognition that when you're a specialist, you're there kind of quite intensely working. And then, so the turnover in that pool is very quick. So therefore, then there's a lot of demand for those profiles. So it kind of depends on, I guess, when you're wanting to think about MSF. I tend to advise it's probably better to go when you're much more senior, because I think then, as I said, you have to be quite self-sufficient. And when you're working with local doctors and nurses, they are looking at you as the expert. And I think the more time you've done, and the more you've kind of gained from training, I think the more value you will add to the mission. But of course, I have a number of friends who have gone as junior doctors who have done quite well too. So it is possible. I think it's just kind of important to know the difference, I guess, in terms of the different types of profiles.
Those are some really good tips. So I'm sure our medical students are going to be very happy to hear all about that. And so I guess if you were to go back to your first year of medical school, what would be some advice you'd give your past self?
First year of medical school. I'm just trying to think. It's a while ago. I think I guess one thing I'd probably say is that stay the course. I think that's probably I'm sure you appreciate, and the other medical students can appreciate. It's such a long road, isn't it? To try to firstly become a doctor, and if you're aspiring to becoming a humanitarian doctor, that's a even slightly longer road. And I think it's along the way that there will be lots of obstacles or lots of things that kind of slow you down a bit. And I think I've had a number of moments throughout my my time, and that I've kind of thought, oh, maybe it's easier to just quit medicine and do something else, and go into, I don't know, banking, even though I'm not terribly great with numbers, but I don't know, it feels like a career that's not going to be so like self-sacrificing and demand so much out of you. But I guess if I were to tell my medical student self that I get to do what I do now, and that's just from persevering and just just kind of trying to just like chip away and like still feeling like even if there's lots of challenges, you overcome it and you get to then become a humanitarian doctor, which is I think probably the thing I'm proudest of in terms of the things I've achieved. And it kind of gives my life so much meaning that then I think that all the kind of years of sacrifice and hardship and whatever is all worth it. So I think if there's your fellow friends and colleagues in medical school that are thinking about a future as a humanitarian, it's worth it. Like it's truly worth it. It kind of gives you more than is taken from you, but to get there it does take a lot of work and a lot of time and a lot of sacrifice. And I think you just have to kind of trust that the outcome is worthwhile, and I can attest to that myself, having been through the process.
Thank you so much. That is so inspiring as a medical student myself, hearing that in the future, all the hard work will really come to fruition. That's really inspiring to hear. And I'm sure for the viewers, it's going to be super valuable to hear it from a doctor like yourself as well. And I think that's all the questions I really had. Is there anything else you'd like to kind of end off on before we finish off today?
No, I just wanted to say thank you for the opportunity. I think I see it somewhat my responsibility, of course, the MSF work, looking after patients in MSF settings is important, but I do hope to inspire a new generation of humanitarian workers. Even though a lot of people want to work for MSF, we still have we still sometimes have trouble trying to recruit, and for various reasons, I think people do come to work for MSF, and many then choose to not continue for lots of different reasons, and it is because the work's not easy. So I think I'm always kind of excited about the opportunity to kind of spread the message, so to speak, because it's important work, and as I'm sure you can appreciate, the world's not such a kind place, it feels like at the moment, and it feels like there's more wars than ever, and Ebola, there's that Ebola outbreak that's happening in DRC at the moment, and the role of humanitarians is more essential than ever. And I think that if there's at all a little spark in you that tells you that this is something that you like to do, I think kind of look into that, and I'm very happy to be contacted if people want a bit of guidance on how to get there. But I think it's just important not to kind of diminish that spark, because the world needs it. I think it's a tricky time, but I think if there's enough of us that want to make the world a slightly kinder place than it was tomorrow than it was yesterday, I think maybe that's enough. So I'm very excited to hopefully again inspire more people to be able to do MSF or work as a humanitarian.
Thank you so much for joining us today. That was incredible. That was an incredible finish, and we really appreciated your time with us. I guess for our viewers, if you want to find out more about MSF, please head to their website. So it's msf.org.au, or you can use their Instagram page at MSF-ANZ. And if you'd also like to learn more about global health and global health opportunities for medical students, please follow us on Instagram and Facebook. So we're at AMSA Global Health. Thank you so much again. We really appreciated it today.
Thank you so much, Anahita. Thank you for the opportunity.
Thank you.